Dub Nation holding its collective breath after Kevin Durant went down in a heap last night and injured his knee. It happened in last night's loss to the Wizards. The big man, Zaza Pachulia, here goes down and lands right on Durant's leg, the left leg. The prognosis, it's a grade 2 strain of the medial collateral ligament, the MCL, and a bone bruise on his tibia. And with the playoffs just 6 short weeks away, will Kevin Durant be ready to go? Let's find out. With more on that, we welcome Dr. Marc Safran. He's a sports medicine surgeon at Stanford Healthcare. Doctor, thanks for joining us.
Thank you for having me.
Grade 2 strain. Tell us what that means of the MCL.
So the MCL is a medial collateral ligament, or the ligament on the inner side of the knee, and it's the most commonly injured ligament in the knee. And we grade these in grades 1, 2, and 3. A 3 is a complete tear. A 2 is where it's just microscopically torn, so the overall integrity or length of the ligament is maintained, and a grade 2 is stretched out a little bit.
How long will that take to heal, do you think, even though you haven't seen him?
Yeah, not specifically about Kevin Durant, but in general, these ligaments tend to, grade 2 tends to take about 4 to 6 weeks to heal.
Okay, well, that's within the time frame. Now, I heard the bone bruise might be a bigger deal long term. Tell us about that.
Well, usually to sprain the ligament, this is a right knee. This is the outer side of the knee and the inner side of the knee, and this is the medial collateral ligament. And to sprain it, it has to be stretched. So there's a force opening up on the inside, and so it levers on the outer side. So the harder thigh bone or femoral condyle pushes against the softer, or maybe a little bit weaker, less stiff leg bone, and so it has to push against there. And sometimes, if it pushes a lot, you can get some bone bruising, and you would almost expect that to some degree. And it doesn't really affect the ability for the MCL to heal.
I know you don't have a crystal ball, but 4 to 6 weeks, playoffs. Do you see Kevin Durant probably playing some time? Is that realistic come playoff time?
I'd think so. In general, most people can heal within 4 to 6 weeks. He's got a great medical staff. He's a healthy young guy. You would expect that it should heal in 4 to 6 weeks, and that the playoffs would most likely be in the picture. Yes.
Well, we're looking at some video as Kevin kind of limps off the plane here at Oakland Airport. Talk about his rehab program. What's in store for Kevin Durant in the next month?
Well, they'll try to reduce the swelling in his knee. They'll try to work on his range of motion so his knee doesn't get stiff. And they'll work on strengthening his leg, all in the planes where his leg is straightening and bending, and trying to avoid side-to-side movements that would actually strain or stress the ligament while it's trying to heal. Oftentimes, he'd be using a brace to help protect that ligament. And if he's having trouble walking because of this injury, he might even be on crutches for a little bit until things calm down. Is
this the worst injury that could happen to a basketball player? Because it's, you know, that quick energy going side to side and quick spurts up and down and that kind of thing?
Well, not really. We hear more about the ACL, because when the ACL tears, that's usually the end of the season, because it doesn't have much capacity to heal. Mm-hmm. The MCL does heal, and he should ultimately heal fine, and will be able to get back to going up and down. I think last year, Steph Curry, and near the end of the season, also had an MCL injury, grade 1, but also had the MCL injury, and you see he's back pretty well as well. So I think the expectation is that this should heal up fine, and it isn't really the worst thing that could happen, because this will heal. He shouldn't have really any long-term consequences from this injury, and it shouldn't affect him down the road. Well, that is good news. They still have Steph, Clay, and Draymond as well, so I think they're going to be okay. Doctor, hey, thank you so much for your insights. We appreciate it. Thank you for having me.